civilization in South Africa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, show us their choice of blessings. Ya Allah, show us their mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammad Rasulullah sallallahu alayhi wasallam. It's time for Medical Files with myself, Faisal MJ Suleiman, and Medical Files is brought to you by the Islamic Medical Association of South Africa. Assalamu alaikum wa rahmatullahi wa barakatuh, and we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, as well as all of you listening to us on audio streaming, Facebook, YouTube, and all other platforms. Our topic for discussion this evening is breastfeeding dilemmas, and our special guest is Dr. Ridwan Ismail Omar. Dr. Ridwan Ismail Omar, Assalamu alaikum wa rahmatullahi wa barakatuh, and thank you for joining me on Medical Files.
Wa alaikum assalam wa rahmatullahi wa barakatuh to you, Brother Faisal, and Jazakallah khair for having me here.
Absolute pleasure, and actually excited talking to you this evening.
Alhamdulillah.
Dr. Ridwan Ismail Omar is a specialist pediatrician practicing at the Crompton Hospital and a visiting pediatrician at the Ahmed Al Qadi Private Hospital. He's a doctor of medicine from the Dominican Republic. He's got his MBCHB from Pretoria, Medunsa, and his FC Ped training at the UKZN. And as I said, our topic for discussion is breastfeeding dilemmas. And Dr. Omar, let's just dive into it straight. Breastfeeding, is it good for the mother?
Bismillah ar-Rahman ar-Rahim. I begin by praising Almighty Allah, and I send abundant salam on our beloved Nabi Muhammad Rasulullah sallallahu alaihi wasallam. Yes, to answer your question, breast is the best.
I like that. Yeah. And let's talk about the baby. Is it good for the baby?
So there's multiple advantages to breastfeeding. There's advantages for the mother, for the health of the mother, and there we refer to the physical health of the mother, the emotional health of the mother, the mental health of the mother, and then the significant benefits for the baby. And here we're talking about the baby's neurodevelopment, the baby's immune system development, the baby's feed tolerance. The list can go on and on. So there's a lot of benefits for both mother and baby, and inshallah during the course of the discussion we'll touch on those aspects in more detail.
And then obviously there's an Islamic aspect to it as well.
Absolutely. There's a lot of reward.
Absolutely, yes.
in breastfeeding your baby.
Now, you did mention that we'll discuss some of the advantages as we go along. But what are some of the common problems with breastfeeding and how do we deal with them?
So the commonest problem that I experience every day, which is Monday to Sunday, during my ward rounds in the nursery.
Yes, I like that, yeah.
With the newborn babies, when I go in. So my usual day starts when I go and see the baby in the nursery. And after I check the baby, I go and see the mom and I update her on her baby. And the commonest complaint or concern that I get from the mother is, doctor, I always ask them, how's the feeding going? Because that is the most important activity for the baby, is to feed. And the commonest concern that the mothers bring to my attention is there's not enough milk or there's no milk coming out. And I think that our listeners out there need to be reassured that the milk will come. Like anything else in life, to be successful at it, you have to be patient and you have to be perseverant. And mothers need to understand that human milk takes up to a week before you will get the full supply and the proper supply of mature human milk. For the first few days, it's a liquid, a goldish colored liquid that's called colostrum. It's what comes out for the first few days. The baby doesn't need much. Surprisingly, for the first 24 hours of life, the baby's tummy is about the size of a cherry. And the capacity of a cherry is about 3 to 5 mils, which is all the newborn baby needs for the first 24 hours of life. So that colostrum that you're producing, which is about 5 mils, is a teaspoon. Okay. And we all know how little a teaspoon actually is. And almost all mothers will be able to produce that amount of colostrum every 3 hours, which is the interval at which the newborn baby must be fed. But that colostrum, we call it liquid gold for a very special reason, because it's very rich in immunoglobulins. And immunoglobulins basically is what our immune system is made up of. So what we're actually doing is we're boosting that baby's immune system right from the very start.
Okay.
So it's a rich liquid, lots of immunoglobulins in it. It's called liquid gold. Your baby doesn't need much of it. The baby doesn't need 30 and 40 mils from day one. The baby's stomach can't even hold that much.
Okay.
So I want the moms to know that the little that you're getting on day one is enough for the baby.
But every mom will produce something.
Yes, they must produce. They must produce.
Okay.
The important thing to get breastfeeding going is the baby must be put onto the breast. We call it the golden hour, within the first hour of birth.
Oh, okay.
Because that is when the baby is most alert. That is when the baby's reflexes, I'm talking of the sucking reflex, the rooting reflex. Rooting reflex is the little reflex we elicit, if you stroke the side of the baby's mouth and the baby's head will turn in that direction.
Yes.
And those of you with newborn babies, you can actually try it out. You just gently stroke and you'll watch the baby turn. That's a primitive reflex. It's a newborn reflex. It's called the rooting reflex.
Okay.
The baby's reflexes are sharpest in the first hour of life. So as soon as the baby is born, the best thing to do to make sure that the breastfeeding is successful is to put the baby to the breast. So best is immediately after the baby is born, take the baby and put the baby onto the breast.
Okay. I wondered why the gynecologist did that. I mean, when the baby was born, they give the baby to the mother and immediately.
That's the best thing. And it also helps to establish bonding with the baby. It also helps. You see, that skin to skin contact is very good because you must remember delivery suites. Nowadays, most of the mothers deliver in a hospital environment.
Yes.
And those delivery suites are air conditioned. It's cold. The baby is coming from the womb where the temperature is about 37 degrees centigrade. And the room temperature it's air conditioned. You're looking at a temperature of between 18 to 20 degrees.
Yes.
There's a sudden drop in temperature and the baby feels cold. So to keep the baby warm, the best place is on the chest of the mother. Also, the microbiome, which is the skin of the mother, has healthy bacteria on it, which gets transferred onto the skin of the baby, which helps to boost the baby's immune system as well. So there's more than just keeping the baby warm, and that's the ideal temperature that we're keeping the baby at, which is the temperature of the mother's body, which is where the baby has just come out from. We're also establishing physical bonding, which makes a big difference. Emotionally, it's very, very soothing for the mother. You must remember, labor is a very difficult process. It's a very painful process. That 9 months that the mother carried that baby is exhausting. And all the people out there who are pregnant will know exactly what I'm talking about. I mean, towards the end, they can't turn,
Yes,
they can't stand up. They don't know whether to sit or whether to lie down. So, that moment is so precious because it has come with so much of effort. So enjoy that moment by bonding with the baby and then put the baby to the breast because the baby is hungry at the time and the baby's sucking reflex will be the best immediately when the baby is born. And one of the ways to make sure that we do get success with breastfeeding is to try and get the baby to latch on immediately after birth because after about an hour, the baby will fall off to sleep.
Okay.
And then, especially in the first 24 hours, it's very difficult to get them to wake up because they tend to be quite sleepy. They will wake up every 3 hours for a feed and they need very little. And then they go back to sleep. And then usually by day 2, they start getting more alert. And by day 3, they're very alert and very hungry. And by then, the mother is starting to produce more milk. So it's very important to establish breastfeeding in the first hour of life.
Now, what happens if for some reason the mother can't produce milk? Is it natural that she will? Or are there instances where she can't?
Look, you're going to get rare circumstances, but a lot depends on the mother preparing herself mentally prior to the delivery. You have to start off with a positive mindset that I'm going to breastfeed. I'm not going to try formula at all. It's not even going to be an option. I'm going to give it my best shot. And there should be no physical reason why a healthy mother who could produce a healthy baby shouldn't be able to produce milk. Okay. And we always believe as Muslims that when a human being is born, each person comes with their own risk, with their own sustenance, with their own, with their own nourishment. And this mindset is what we should start off life with. This baby here has come with its own sustenance, and part of its sustenance is that milk. So Allah Ta'ala, just like how He created that baby and brought that baby into this world, that baby will come with its own nutrition as well.
Alhamdulillah. I like the way you put it, really. Just to remind our listeners, this is an interactive program and our topic for discussion is breastfeeding dilemmas. Our guest is specialist pediatrician Dr. Ridwan Ismail Umar. And the number in the studio for your WhatsApp questions for Dr. Umar is 060 904 1056. I repeat, 060 904 1056. Any questions on breastfeeding dilemmas, please forward them and doctor will deal with them. Also, just to remind you, the Doctors and Guests on Medical Files program will help you with any medical problems that you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on medical files. Dr. Umar, are there instances where breastfeeding is contraindicated?
Yes, there are. So what we mean by that is, are there situations where we would say to the mother, do not breastfeed the baby? So for the entire part of our discussion, we were focused on encouraging mothers to breastfeed their babies because of the numerous benefits for the health of the mother and the health of the baby as well. But there are a very few list of conditions where it is not safe for this mother to breastfeed the baby, and I'll list 2 or 3 conditions. So number one is in the unfortunate event that the mother has cancer and is receiving chemotherapy. Those medications, those drugs that the mother is receiving to treat that malignant disease is definitely going to be a high risk to the baby, and it can cause more harm to the baby than the benefits of the breast milk. And in a case like that, we would definitely advise the mother to not breastfeed. In developed countries, HIV infection in the mother is a contraindication to breastfeeding because although the risk is minuscule, it's a low risk, especially if the mother is on treatment for her HIV disease and her HIV disease is well managed, which means the viral load is completely suppressed. But there is a risk that the virus can be transmitted through the breast milk from the mother to the baby. So in developed countries, it doesn't apply in our South African public healthcare system, but in developed countries, breastfeeding in HIV positive mothers is another contraindication. A mother who's acutely psychotic, so a mother who is mentally ill and mentally disturbed, because there's a risk that she can harm her baby during the process of breastfeeding. So definitely in that situation, we would say that breastfeeding is contraindicated. And then there's a few metabolic conditions. But I think for the benefit of our listeners, if you're worried about whether breastfeeding is safe or not, speak to your doctor and your doctor will tell you. I commonly get asked the question, and this is the commonest: mom who's taking antibiotics for an infection that she might have got during the birth process or after giving birth, maybe a few days later. Most of the antibiotics that is prescribed for the mother is safe for the baby as well. Whatever amount is secreted through the breast milk is very safe for the baby. So as long as your doctor who's prescribing the antibiotic for the mom is aware that the mother is breastfeeding, they will make sure that they prescribe. And there are plenty of antibiotics available to treat, whether it's a mastitis like a breast infection, or whether it's a urinary tract infection or a wound infection that the mother developed after giving birth. But most antibiotics are safe to give to the mother while she's breastfeeding, and breastfeeding shouldn't be stopped because the mom is on antibiotics. It shouldn't be stopped if the mom is on the pain medication that's prescribed specifically for her after the delivery to ease the pain of either cesarean section, or sometimes they get an episiotomy after they give birth. They have to make a little incision to widen the birth passage. So the doctor who's prescribing that is very well aware that the mom is breastfeeding, and they will prescribe effective pain medication or antibiotics if necessary for the mother that is very safe for breastfeeding the baby as well. And taking those type of medications should definitely not be a reason to stop breastfeeding. So to summarize, there's very few conditions where we totally discourage breastfeeding because it would be harmful to the baby.
Now, there's a question that's come through from a listener, and I'll just tell you quickly what the question says. Assalamu alaikum wa rahmatullahi wa barakatuh. If a mother was under general anesthetic at time of birth, hence couldn't breastfeed in the golden hour, when is the next best time to feed? It goes on also, if baby is drinking from breast but not getting full, baby is 1 month old, Should mother use formula to supplement or wait till milk comes? Meaning that she may have to feed every hour rather than 3 hours because milk is not enough. You got both the questions.
So those are two very good questions.
Yeah.
Jazakallah khair for asking them. So the answer to the first question is, if the mother has delivered by cesarean section under general anesthesia. So most of the time we try to avoid the delivery under general anesthetic for multiple reasons. Firstly, because the mother is not awake to share in the joy of the birth of her baby. It is a very joyful moment, it is a very happy moment. And we try our best for the mother to be a part of that moment, to hear that first cry of the baby. So a general anesthetic is only given under exceptional circumstances. For example, if the mom has some severe spinal abnormality where they couldn't put in a spinal anesthetic or an epidural, as it's often known as, or if the anesthetist was unable to successfully deliver the anesthetic through the spinal cord, then they would sometimes opt for a general anesthetic. Or if the mother has some sort of a medical condition that prevents a spinal anesthesia, then it's done under general anesthesia. And unfortunately, that golden hour cannot be established, the feeding during that golden hour, because it's going to take time for the mother to wake up. It's going to take time for her to recover. They'll only start waking her up long after the baby has even gone to the nursery, because the gynae still has to close up the wound. They have to dress the wound. Then she has to go to the recovery to recover from the anesthesia. And then she's going to be very groggy and drowsy for a good few hours after that. So one of the reasons is that we try to avoid a general anesthetic, so that the mom and the dad can both be present at the time of birth and share in the joy of that momentous occasion. And secondly, it's to allow breastfeeding to occur, because unfortunately, if the mother had a general anesthetic, it's impossible to establish breastfeeding the golden hour.
Absolutely.
And it's a big loss for both mother and baby. Of course, the mother must still try as soon as she feels a little better, but it is more challenging because after a general anesthetic, they're also going to use opioid pain medication. So things like morphine and pethidine, which is going to make the mother excessively drowsy. And so she's not even going to be in her proper senses for at least a day or two after giving birth. And so it's going to make it very difficult for her to manage to breastfeed. But she should still try her best when she's feeling better and strong enough to start breastfeeding the baby. But unfortunately, in that situation, the golden hour is lost. With regards to the second question, which is if there's not enough milk. Now, by 1 month of age, there should be more than enough milk. If there is not enough milk at that stage, then that means there is a problem. The commonest problems is if the mother is too anxious, if the mother is too stressed, if the mother is not drinking enough water. You must remember, for the body to produce milk, the mother needs to be well hydrated. Milk is basically, it's protein, carbohydrate, fat, and water. That's human milk. And then there's a whole lot of micronutrients, vitamins. So for the mother to produce sufficient quantities of milk, she needs to be drinking enough water.
Okay.
It's very important that she must drink water. It takes about a week for mature human milk and for the correct amount to be established for what the baby needs. So a month is way too long. There are medications that we can prescribe to increase the amount of breast milk that the mother is producing. Because remember, breast milk is a product that's produced by the mammary gland or the breast. But it's the sucking reflex of the baby on the nipple that stimulates glands in the brain to release hormones, and those hormones in turn send messages to the mammary gland, which is the breast, to produce milk. So the more the baby suckles on the breast, the more those hormones, prolactin and oxytocin it's called, will be produced. But there are medications available that can increase the levels of those hormones and increase the amount of milk that the mother is producing. So I have a lot of patients who cannot produce enough milk for whatever reason, but they're very keen and enthusiastic to breastfeed, and we encourage them and we try to support them as much as we can. So there is effective medication. Formula should always be a last resort.
Absolutely, yeah.
Yeah, so there is medication we can try first. But I always emphasize to the mothers is they mustn't stress, they mustn't be anxious, they mustn't, panic. Another reason why babies cry is babies, and I always tell the parents, is your baby in the first 3 months, they want to be cuddled all the time. So people often think that there's not enough milk and that's why the baby is crying. Most of the time there is enough milk, The baby just wants to be in the arms. So babies don't like, the newborn baby doesn't like to be just fed, burped, and put aside and left all alone. And they feel ignored. They feel unloved. They don't like that.
Yep.
They want you to hold them. They want you to cuddle them. And in fact, I tell the moms, the only time you should put your newborn baby down is if you need to go to the bathroom.
Okay.
Otherwise, hold your baby all the time, especially in the first 3 months. It's very important. You'll have a very calm, happy, and content baby with you. Breastfeed and keep your baby in your arms all the time. They love that. We call it, it's like what we call kangaroo mother care.
Yes.
KMC. Skin to skin contact, Put the baby in your chest and watch how your baby will settle down and be so calm.
Alhamdulillah. There's another question that's come through. I've got like a minute before the ad break, but before I'll pose a question, then we'll take the ad break, right?
Okay.
So we can just think about it.
Okay.
Yeah. Actually, I'm glad you didn't say the mother needs to eat grass.
Grass.
Grass. Drink a lot of water, man.
Oh, okay.
Okay. All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Doctor, baby is 2 weeks old, exclusively breastfeeding, but baby is crabby. Baby doesn't sleep well. How will I know if baby is still hungry? If it's not hunger, what can be the reason for the uneasiness? Doctor's done a checkup and nothing is medically wrong with the baby. Now, whilst you considering that, just want to remind our listeners that our topic for discussion is breastfeeding dilemmas. Our guest this evening is Dr. Ridwan Ismail Omar, who is a specialist pediatrician practicing at the Crompton Hospital. And this is an interactive program. So if you have any questions on breastfeeding and breastfeeding dilemmas, you can forward them to us via WhatsApp on 060 904 1056. We'll visit the marketplace and continue on the other side of this, inshallah.
Wonder Dates, your one-stop shop for all your dates, nuts, dried fruit, spices, biltong, biscuits, sweets, chocolates, Islamic lifestyle goodies, and so much more. Wonder Dates is known to import unique and unusual products from around the world. So, if you're looking for something nutty, nibbly, chewy, munchy, sweet, sour, or savory, make a date with Wonder Dates. Visit us at 9 Peter Road, Springfield, Durban, or call on us on 031 577 7722 or shop online at www.wonderdates.online. Wonder Dates, bringing the freshness of the farm into your home.
J. Junaid Jamshed brings you the Freedom Sale. Enjoy up to 50% off on all items from 14th August at 222 Felix Lamini Road, Overport. Visit our stores or shop online at za.junaidjamshed.com.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Do you want to win a prize?
Flip it.
Do you want to win 2 prizes?
Flip it.
3, 4, 5 prizes?
Hey, flip it, man.
You can win up to 5 prizes a day on the Breakfast Rush when you play
Flip it.
exclusive to the Breakfast Rush on Radio Al Ansar.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment, Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment, Recovery and Wellness Center, the addiction recovery specialist on 031 563 0751.
You're listening to Medical Files, brought to you by the Islamic Medical Association and hosted by myself, Faisal MJ Suleiman. Our topic for discussion is breastfeeding dilemmas, and our special guest is Dr. Ridwan Ismail Omar, a specialist pediatrician. Now, Dr. Omar, the next question that came through us, in fact, Assalamu alaikum wa rahmatullahi wa barakatuh. Doctor, baby is 2 weeks old, exclusively breastfeeding, but baby is crabby. Baby doesn't sleep well. How will I know if baby is still hungry? If it's not hunger, what can be the reason for the uneasiness? Doctor's done a checkup and nothing is medically wrong with the baby.
Wa alaikum salam wa rahmatullahi wa barakatuh. That's a very good question because it's a very common problem that we encounter every day. So the fact that the doctor has checked the baby up, at least that should put our mind at ease that everything is fine with the baby and that the baby is healthy and doing well. I'm sure part of the checkup included a weight check, which is very important in the newborn assessment. And if he said everything is fine with the baby, it means that this baby is getting enough milk, because the baby's weight will only be appropriate if the baby is getting enough milk, because there's no other source of nutrition for the baby. So that on its own should tell us that there is enough milk and that the baby is not crying because there's not enough milk. And like I mentioned earlier, babies want to be held all the time. They want to be cuddled. And I know the grannies and the old people, they keep saying, don't spoil the baby with arm. It's the complete opposite. The newborn must be kept in the arm as much as possible in the first 3 months. So there's 5 common reasons why the newborn baby will cry. Number 1, if they are hungry. We often think that the baby is crying because the baby is hungry, but if the baby has just fed and the baby had a good enough time on the milk, on the breast, which is what we usually say between 10 to 15 minutes of vigorous sucking on each breast, that would have been enough time for the baby to fill its tummy, especially in a 2-week-old baby. So if you know that your baby fed for 10 to 15 minutes, sucked vigorously on each breast for that amount of time, and your baby starts falling off to sleep, that tells you that the baby is full. But if 5 or 10 minutes later, the baby is now crabby, then your baby probably needs a cuddle. That's the second reason why a baby will cry.
Okay.
Thirdly, so I said there were 5 common reasons. Thirdly, if the baby is either overwrapped, and that's the commonest reason that I find babies sweating all the time and coming with all sorts of skin rashes. So I think it's just a human tendency to want to overdress the baby.
Keep the baby warm. Yeah.
Too many layers of clothes. They'll have like 3 rompers plus another fleecy romper. Then they'll have 3 blankets. They'll have a hat. They'll wear mittens plus 2 pairs of socks when they come to the room. Those little babies are getting roasted in that. I
can imagine,
outfits.
yeah.
So if the baby is too uncomfortable, overdressed, which is the commonest reason, the baby is going to cry. And I usually tell the mothers, the baby and the grannies, because the grannies play a very big role in how the baby is dressed.
Yes.
One baby grow and 1 receiving blanket in a warm room is how this baby should be kept. So if your baby is feeling too hot or too cold, the baby is also going to be crabby. The 4th reason is if the baby needs a nappy change. So always check the nappy, because these babies, if their nappy is wet or soiled, they're going to cry, they're going to be restless. And then the 5th reason, which in a 2-week-old baby is something to think about, and it's common, is colic. Colic is a very common reason why babies would be a little crabby. So it's not usually the milk, especially if the doctor checked the baby and said that this baby is well. It means then that baby is getting enough milk, because he would have checked the weight, and the weight would have been adequate weight gain for that 2 weeks. So the issue there then is not insufficient milk. It's one of those other reasons that I mentioned. Those are by far the commonest. Colic is a topic on its own. We can spend a whole night talking about it, but just for everybody to understand, because it's so common, when we refer to colic, we refer to a gassy baby, a fussy baby, or a crying baby. In the old days, we used to refer to it as inconsolable crying, but that definition has now been reviewed and revised and redefined. So even a baby who's just, twisting and turning and cramping and cringing or just gassy, that is infantile colic. So you get different grades of colic. You can get mild colic to severe colic. So there's many reasons why that 2-week-old baby is still fussing. And most of the time, the baby just needs the cuddle.
Thank you for that, Dr. Omar. The next question comes through. What are the issues with formula? Ma, for a layman, we don't know. Please explain in simple terms.
Okay, I'll try my best to be as simple as possible by starting off with the benefits of breast milk, which you won't find in formula milk. So firstly, when a mother is breastfeeding, that baby latches onto the breast and that baby suckles on the breast. That has significant physical bonding benefits for mother and baby. Number 2, studies have shown that mothers who breastfeed their babies have a lower incidence or a lower risk of getting what we call postpartum depression. Postpartum depression or postpartum blues is very common. Those of us who have had ladies in our home, daughters or sisters deliver, would have, or wives for that matter, most of us would have experienced that to some extent, where after the mother gives birth, there's a whole lot of hormonal changes going on in their body that causes them to have, we call it postpartum blues, or it can become severe enough to be called postpartum depression. So mothers who breastfeed have a lower risk of getting postpartum depression and postpartum blues, where they can actually become very depressed. So there's a lower risk of that. mothers who breastfeed their babies have been shown to have a lower chance of getting breast cancer, and there's even some studies to suggest that they have a lower risk of getting cancer of the ovary. So there's lower risk of cancer also in the mother. So those are some of the benefits which you will not get by giving your baby formula. With regards to the baby, there's amazing work being done and research that's being produced now to show the link between the baby's gut and the mental and the brain of the baby, and the link between the two. Now, breast milk is rich, and I'm trying to make it as simple as possible. It's rich in a lot of substances which promote the health of that baby's gut, so the intestine. And there are studies, it's amazing studies that have now come out which showed that by maintaining a healthy gut in the baby, you're actually promoting a healthy brain. And we all want intelligent babies, we all want intelligent children, so there is a big link that they've now found between the baby's gut and the brain. Now, breast milk, human milk, doesn't fill those requirements to match what breast milk can do. Those are just some of the few. We mentioned colostrum. Colostrum is rich in immunoglobulins, which is something that's part of our immune system that protects us from getting sick and that fights diseases, that fights allergies. Breast milk doesn't have that. Formula has its own problems, which is now directly answering your question. Number one is it costs a lot of money. Breast milk is free of charge.
Yes.
That's the first thing. You don't pay for it. It's available all the time. Sometimes if you formula feeding and then you realize middle of the night the formula is finished, you got to jump in your car, or if you don't have a car, you got to start making some plan to go and buy formula milk in the middle of the night.
At ridiculous prices.
Exactly.
Yeah.
And you're risking your security and all that. So breast milk is always available. It's readily available. It's instantly available. Formula requires preparation. You got to go put the kettle on. You have to have electricity. You have to boil the water. You have to prepare. There's a risk of that milk getting infected. You got to have all the sterilizing equipment. Breast milk is always ready. It's instantly available. And all of us who have babies know when that baby is hungry, that baby screams.
Absolutely.
That baby wants the milk immediately. That baby can't wait even 2 seconds. With breast milk, that baby's milk is ready. All you have to do is take out your breast and put it in the baby's mouth, and the baby will get instant gratification.
Absolutely.
With formula, the baby has to learn to make sabr because you have to prepare everything for that. And that preparation takes time, which the baby doesn't understand.
And sometimes wait for it to cool down as well.
Exactly.
Yeah.
So there's even more disadvantages to formula feeding. But I mean, those are
the
just
questions are actually pouring in.
Okay.
And time's running out. So,
but I hope I've answered the question.
Alhamdulillah, Jazakallah khair, doctor. My niece is not breastfeeding, but pumps breast milk for feeding. Her 5th baby, now 3 months old. She says milk production is getting less when it's time to use breast pump. Why is this?
So,
and then I'll just do the continuing question. Does the breast pump not work similarly as when the baby is suckling on the breast?
Yeah, so well, at least the mother is giving, so we call it expressed breast milk. For short, we call it EBM. EBM is expressed breast milk. So all the benefits that we spoke about with breastfeeding will still be passed on to the baby. So, all the little things that are found in breast milk that promotes the health of the baby's brain and the baby's gut and immune system. The best pump for the milk is the baby, and that's what I tell the mothers. When they ask me, doctor, which machine must I buy and which milk do you recommend, I always tell the moms the best pump you can use is your baby. Let your baby pump the milk out. But the concept is pretty much the same. I mean, it's meant to imitate or copy what the baby is meant to do by latching onto the nipple and sucking out milk. And then you get the manual pump and the electric pump. If the mom is not producing enough milk, we spoke about some of the reasons why the milk production can decrease, and there are medical means to increase the breast milk. There's a tablet you can take that will increase the milk, and it's very effective.
Another question is, Assalamu alaikum wa rahmatullahi wa barakatuh. When is the earliest one can wean off breastfeeding? Will a balanced diet and cow's milk be sufficient after baby turns 1 year old?
After 1 year old, it's safe to give the baby cow's milk. Before 1 year of age, we do not recommend fresh cow's milk at all, because there are certain risks that we think might be problematic with giving the baby fresh cow's milk. So definitely before the age of 1 year, fresh cow's milk is an absolute no. But after 1 year, you can give it at any time. As Muslims, we are allowed to breastfeed our babies for 2 years. And there must be wisdom in that. There must be some goodness in that, apart from the physical benefits. But science has only recently come up with that recommendation. I mean, our Prophet Muhammad sallallahu alaihi wasallam taught us over 1,400 years ago that it is allowed to breastfeed for 2 years. And if you look at the current WHO, World Health Organization guidelines, their recommendation is to breastfeed for 2 years because they found scientific benefit and merit in it and other reasons as well. I think, and I always encourage my patients to breastfeed for 2 years. Firstly, because there is divine wisdom in it. The fact that it is an Islamic teaching means there is some divine wisdom in it.
Yeah.
The first 6 months, your baby will thrive very well on exclusive breast milk. The baby doesn't need anything else. But after 6 months, breast milk on its own is not going to meet the growth and nutritional requirements of the baby. That is why your baby must be weaned onto some solids from 6 months onwards. So you got to add some type of fruit and vegetable to the baby's diet, because milk on its own is not going to meet the requirements. After 1 year, then you can use fresh cow's milk as well.
Assalamu alaikum. My granddaughter is 9 months old, only drinks breast milk once a night. No matter how hard the mom tries to feed her, she refuses to take and is having formula now. Is it normal? Jazakallah.
It's common. So you see what happens is when we do mixed feeding means we do both breast and formula. And I always tell the parents, the moms, that rather mix feed than give up the breastfeeding, because sometimes moms have to go to work for whatever reason and they can't be with their baby 24 hours of the day. So I tell them, well, then don't give up the breastfeeding. Continue to breastfeed when you are available and when you are with the baby. And when you're not there, you got two options. You can either express the milk and store it, and breast milk can be stored in the freezer for up to 6 months. Or you can, if like in the case of this listener, they chose to formula feed during the day and then breastfeed at night. So the one disadvantage with mixed feeding is it causes nipple confusion. The little baba gets confused now, because the teat of the breast of the bottle and the nipple of the mother is very different. So some babies, they actually would stop the breast once they get used to the bottle, because breastfeeding is a very active process and requires effort on the part of the baby. The baby actually has to work hard to breastfeed. The baby has to suckle on the nipple and draw the milk out. The baby has to pull for that milk to come out. Whereas bottles are designed in such a way, and the teat and the size of the teat, that the milk just passively flows into the baby's mouth. So some of the babies get a little lazy and spoiled. Yeah. So it's best to exclusively breastfeed, but if that's not possible for whatever reason, then rather mix feed. So that's why that baby is probably just refusing the formula or the breast during the day.
Thank you, doctor. Time for us to take an ad break. We'll continue on the other side of this. Please stay with us.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Famine, conflict, and severe economic decline make the humanitarian crisis in Yemen the worst in the world. More than 20 million Yemenis do not know where their next meal is coming from, and over 10 million are suffering extreme levels of hunger. With your support, the Al Imdad Foundation delivers essential food aid to starving Yemeni communities. It's a question of survival. So let's do what's right. Donate online at alimdad.com or call 0861 786 243 for more information.
The Watch Doctor. For watch repairs, watch batteries, watch straps, 21st keys, engraving, and sound for your occasion. Handled professionally at 263 Sparks Road, Mohammedia Center, Suite 104, Overport, next to the Sparks Road Masjid. Contact Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time.
You're listening to Medical Files, and our topic for discussion is breastfeeding dilemmas. Our guest is Dr. Ridwan Ismail Umar, a specialist pediatrician. And of course, any questions on breastfeeding can be forwarded to us via WhatsApp on 060 904 1056. Now, Doctor, let's discuss a bit of weaning. And, you've spoken about introducing solids at 6 months, but what about weaning off? I mean, it's time now for a baby to get off the breast, and now mother can continue the life.
So when we talk of weaning, we generally refer to weaning as the process where we introduce solids into the baby's diet, which is at the latest is 6 months. But in my own personal experience, most babies are ready from 4 months onwards.
Exactly.
That 6 months is way too long for the baby. They don't cope well with 6 months of milk. They're starving by 4 months. They're ready to be fed. With regards to the time period for breastfeeding, like we mentioned, our teaching as Muslims is that we should breastfeed for 2 years. I'm sure the ulama can give us the wisdom behind that, but it's always a challenging process because those little kids at 2 years, they're quite demanding on their mothers. They have now established that habit, and like any other habit that we are accustomed to, it's hard to give up. So it's going to be emotionally and physically challenging, not only for the little one, but for the mother as well, because it's something she's been doing for 2 years and now she's got to stop. So I always tell the parents, look, at 2 years, you have to stop breastfeeding. There's medical reasons for it. And obviously there's the Islamic teaching as well that we should stop breastfeeding at 2 years. I tell the mothers that you need to start mentally preparing your child. These kids at 2 years are very intelligent. They're very sharp. They understand everything and they know exactly what's going on. So from a month before, you need to start talking to them about it. You need to start explaining to them. The mental preparation is very important for the child. And when the time actually comes, you got to set the date and you got to decide, okay, on this day, we're going to stop breastfeeding. And there is a tablet you can take that actually stops the breast milk. It's quite effective. It's taken for 2 days. And in the majority of cases, it will dry up the milk. The baby or the little toddler at that age will probably try once or twice after that out of habit. Because remember, at 2 years old, they're not breastfeeding for nutrition anymore. It's purely for comfort.
Absolutely.
That's the reason they're doing it. So they'll try once or twice, but as long as they've been mentally prepared, and you've been talking to them for a long time about it, they'll see nothing coming out of there. And then you offer them an alternative as well, something that's sweet and something that's tasty and something that they'll enjoy, and they'll quickly adapt to that.
But I think by 2 years, they're eating normal food as well.
Yeah, they should be eating everything.
Yeah.
2 years.
Let's discuss preterm babies.
Yes.
Are there any benefits of feeding a preterm baby, let's say breast versus formula?
Oh, that's such an amazing question. There is nothing better than breast milk for the preterm baby, especially. Because remember that preterm gut wasn't designed to be fed in the first place. Because a preterm baby, for the benefit of our listeners, means a baby who was born before 40 weeks. So depending on how immature the baby is, that tells you how immature the gut is. And a gut, I mean, if a baby is born, let's say at 32 weeks or 33 weeks, those guts were not meant to be fed. But when the baby is born, you have to start feeding the baby. So there's two ways we feed that immature gut. One is we start establishing feeding to prime and prepare that gut for feeding. But while we're doing that, we also give them nutrition through a drip, because you cannot meet the baby's nutritional requirements safely by giving the full volume of feed through the gut. So the best way to handle that gut with the least amount of complications is human milk. There is no better substitute for it. In fact, in the neonatal ICUs that I work at both those hospitals that you mentioned, I kind of insist to my parents, to my patients, the parents of my little babies, that I strictly advise that we only use human milk, because there are far less complications. And prematurity is a very delicate, fragile condition, and it's fraught with complications, especially with the gut. There's real horrible things, to put it simply, that can go wrong. Babies die, preterm babies actually die from complications of the gut. It's well documented, and every pediatrician has seen babies die from gut complications. One of the ways to prevent gut complications in a preterm baby, and it's been proven, is by only using human milk or breast milk in that baby. So for a preterm baby, there should be nothing but human milk going into that gut. It's so much better. It's much better tolerated by the baby. Preterm babies have a lot of complications, like I said. So they have feed intolerance, they have vomiting, they have abdominal distension, they have issues with absorbing the feeds. Those are just some of the common day-to-day complications we encounter in our ward rounds, in neonatal ICU every day with preterm babies. The risks that I've mentioned, all those problems, we see far fewer of it in preterm babies who are fed their mother's milk or breast milk rather than formula. With formula, the risk of complications, including septicemia of the gut or infection of the gut. Okay. Oh yes. So the biggest complication with the preterm gut is it's a condition where the gut becomes gangrene. And every pediatrician has seen that. And the risk is far higher in a formula-fed preterm baby than in a breastfed baby. And it's every pediatrician's nightmare, that gangrene of the gut in a preterm baby.
Now, are there any other use of breast milk besides feeding a baby?
Yes, there is. So, the grannies, they are very valuable people, and they'll actually answer the question better than I would, because they know all the uses of breast milk.
Okay.
So the baby's got an eye problem, they'll tell you put breast milk. By all means, put breast milk. It's very safe. Newborn babies sometimes have a little bit of an eye discharge or whatever it is. There is some benefit in that. So before you sometimes it's difficult to get to the doctor, you can't get an appointment or whatever it is, no transport or whatever. Use some breast milk in the baby's eye and it will work. Baby's got a very blocked nose, sneezing a lot, you don't have anything, put a drop or two of breast milk in the baby's nose as well.
Baby's nose?
Yeah, you can do that.
Okay.
So, but that I told you, the grannies will do a fantastic job telling you what else you can do with breast milk.
Of course, you can't beat them.
And they're the best. They're the ustads, actually. They teach me sometimes.
I'm sure. Now, earlier you mentioned colic.
Yes.
A baby is disturbed, probably suffering from colic. Now, does colic occur less frequent in breastfed babies?
That's an excellent question. That's one of the only conditions that we encounter in the newborn period where there is no difference in the number of babies that suffer from colic, whether they're breastfed or formula fed. It's the same. It's the only one where breastfeeding doesn't confer an advantage, unfortunately. The only condition. Every other condition, breast milk has been proven to beat formula, except with colic. The number of babies, whether they're breastfed or formula fed, that suffered colic is the same.
Let's discuss a bit of breastfeeding support systems and resources. How can you help me there?
So in hospital, well, even out of hospital, so in hospital we have nurses, the midwives who are very trained, very experienced. And in most hospital nurseries, they're very passionate about breastfeeding. And now a lot of the private hospitals have introduced lactation consultants, they call them.
Okay.
So these are registered midwives who've done extra special training. They've done extra courses in breastfeeding, and they masters at it, and they're extra passionate about getting breastfeeding going. So they are available in our private hospitals. They will spend a lot of time with the mother. They will, encourage her, support her, give her all the motivation that she needs. Because remember, the mother goes through a lot when she gives birth.
Yes.
Mentally, physically, psychologically. So to get breastfeeding going, you got to not just look at the amount and the quantity of milk, but you also have to pay attention to all the aspects of the mother's health, her physical health. So those lactation consultants are there. They're very passionate about breastfeeding and getting it going and making a success of it. They're available in hospital. You can even consult them as outpatients. They run baby clinics, so they're available. And then you also get these doulas, which our mothers are well acquainted with, that will come home. They're also very, very good and very passionate about getting breastfeeding going, because they've studied all these things and they understand the benefits of the breast milk. So there's a lot of support from experts, your pediatrician, your doctors. They also would encourage you to breastfeed and help you and guide you. Your gynae will also be able to give you advice if you need any help over there. And a very important support structure that the mothers need is the family when they're breastfeeding. They need a lot of encouragement from the father, from everybody in the family as well. It's the whole team.
No, absolutely. Just our final question. I've got like 2 minutes. Some common breastfeeding challenges and solutions, and some breastfeeding techniques and tips for new mothers.
So, like we mentioned, the commonest breastfeeding challenge that the mothers feel is that there's not enough milk. But most of the time there is. And I've mentioned ways in which we can increase the amount of breast milk. And they must always get advice from ask the grannies first. They're always available and they're experts in all these things. And then also get the lactation consultants, the nurses, the doctor's opinion and advice. And inshallah, the majority of mothers will be able to successfully breastfeed. But you must put your baby at birth on the breast to get it going. So there are studies to show that the sooner after birth you put the baby to breast, the better your chances of breastfeeding this baby is going to be. So it starts at the time of birth that you actually got to start working on it. That's the biggest challenge. Look, if the latch is not correct, so and this is very important, the nipple and the dark skin around the nipple is called the areola. So the entire nipple and part of that areola must be in the baby's mouth. If the baby is only going to suckle on the nipple, that's going to cause a lot of pain for the mother. And that is going to discourage her from breastfeeding, because breastfeeding must never be painful. The mother and baby must both enjoy the whole process of breastfeeding. So I always remind the mothers, if you are feeling pain, it means there's a problem. It means that the latch is not right. You got to make sure that the entire nipple and part of the areola, which is the dark skin around the nipple, must be in the baby's mouth. So if you're feeling pain when you're breastfeeding, then there is a problem. Either the latch is not right, or there might be an infection. That's another problem that breastfeeding mothers experience because of engorged breast, because they're producing too much of milk. Some mothers actually have the opposite issue where they're producing too much of milk. So those breasts can get engorged and then their breasts get infected. And that is a very painful condition. It causes a high temperature in the mother. It causes a lot of pain and discomfort. So that's another issue that you can have with breastfeeding. But those things are all treatable. You got to, pump the milk out, take antibiotics, take pain medication. You can use some heat compressors and all that to relieve the pain, or cold compressors, and that would help. I think those are the biggest challenges that we face on a day-to-day basis with the breastfeeding.
Dr. Ridwan Ismail Omar, Jazakallah khair for joining me in the program this evening. It was wonderful having you on. In less than 30 seconds, do you have a message for our listeners?
Yeah, well, I want to thank you for listening to me. And the fact that we had so many questions means that you guys were interested in breastfeeding, which is excellent, because successful breastfeeding will start by being interested in it. And I just want to encourage everyone out there to give it your best shot, and to just remember that you have to be patient and you have to be perseverant for anything to be successful, including breastfeeding. And breast is the best for your baby.
Shukran. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I would like to thank the engineers for having engineered this evening, and I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. Until then, for myself, Faisal MJ Sulaiman, do enjoy the rest of your week, and it's Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic global perspective. This is Al Ansar News.